Prenatal Development. Fertilization. Do you know how fertilization happens? A pregnancy starts with fertilization. When a woman is joined with a man's sperms, fertilization usually takes place in a fallopian tube that links an ovary to the uterus. If the fertilized egg successfully travels down in the fallopian tube, the implant in the uterus and embryo start growing. The male reproductive system creates sperm that is manufactured in the seminiferous tubule within each testicle. The head of the sperm contains the DNA, which when combined with the egg DNA will create a new individual. The tip of sperm head is the portion called the acrosome, which enables the sperm to penetrate the egg. The midpiece contains the mitochondria, which supply the energy the tail needs to move. The tail moves with whip-like movement back and forth to propel the sperm toward the egg. The sperm have to reach the uterus and the fallopian tube in order to fertilize a woman's egg. The ovum or egg cell is non-motile female gamete that fills with a motile sperm during fertilization and results in the formation of the zygote. Stage on prenatal development divided into 3 periods. The first period is germinal period. Germinal period is begin in a fallopian tube when an ovum is fertilized by sperm to form a zygote. Cell division begins approximately 24 to 36 hours after conception through the process of mitosis. A few hours after fertilization, zygote begin to multiply. Hour 36 become a 2-cell organisms. Hour 48 is 4 cells. Hour 72 is 32 cells, and 70 cells a day later. During multiplications, they migrate along fallopian tube, reaching the uterus within 3 to 4 days. Once there, zygote transforms in the liquid film sphere known as a blastocyst.
Blastocysts float idly in the uterus for a day or 2. Some cells stick together to form an embryonic disc, and this is a dense cell mass, which will continue to develop into a baby. This cell mass classifies itself into 3 layers. The upper layer, called the ectoderm, is transformed into upper organs such as skin, nail, hair, teeth, sensory receptor, including the brain and spinal cord. The middle layer is called the mesoderm, which will develop into the inner skin, muscle, skeleton, circulatory system. The lower layer is called the endoderm. It becomes the digestive system, liver, pancreas, thyroid gland, respiratory system, lungs, glands, and neuron tube, which is the beginning of the nervous system and brain. Part of the blastocyst develop into the placenta, umbilical cord, and amniotic sac. Embryonic period from the 2nd to the 8th week. During this time, embryo grows further because many of his body systems are developing. Congenital disabilities such as cleft palate, missing limbs, blindness, deafness, etc. is often appears critical during the first 3 months of pregnancy. Fetal period is the period that follows the embryonic period until delivery. Born cells begin to appear for the first time around the 8th week. Various parts of the body develop in all aspects until they form. Of course, people who are pregnant will have prenatal risk factors. What are some factors that would influence prenatal development? The first factor is preconceptional factor. Down syndrome is a syndrome caused by having an extra pair of chromosome 21. Patients with low intelligence, slow speech, and difficulty using muscle, and they are quite noticeable of word appearances and may have various health problems, making patients with this disease often have a shorter lifespan than normal people.
Thalassemia is a type of anemia caused by abnormal blood cells. This causes red blood cells to be short-lived, fragile, broken, easily destroyed, and inherited as recessive gene. It is caused by an abnormality in the gene that controls the production of hemoglobin, which is an important substance in red blood cells. Turner syndrome is a genetic disorder found in females. It is caused by an abnormality of the X chromosome. Patients with this condition have only one X chromosome. Chromosomal abnormality results in the patient being characterized by short stature, webbed neck, and spray forearm. It also results in the patient with ovaries that do not develop, no menstruation, and may cause infertility. However, this condition has a chance of occurring only 1 in 2,000 people. The second factor is infection. Maternal HIV increases the risk for prematurity and being small for gestational age. SGA are associated with increased risk of mortality and developmental delay. Transmit the rubella virus to the fetus, causing deafness, congenital cataract, microcephaly, seizure, intellectual disability, autism, diabetes, and thyroid dysfunction. Syphilis has been linked to preterm labor, low birth weight, and death. The third is exposure to toxin. Methanol smoking during pregnancy increases the risk of placental previa, placental abruption, and preterm labor. Exposure to alcohol is the most common cause of developmental disability, including microcephaly, cognitive disability, learning disability, ADHD. This can cause the placenta beginning at 12 weeks gestation and accumulate in fetal tissue. Outer duct can also cause developmental disability. The fourth factor is a maternal chronic illness. Maternal diabetes increases the risk of fetal anomaly, macrosomia, subsequent birth injury, and hypoglycemia. Hypertension, or combined with a renal or autoimmune disorder, can cause placental insufficiency and inadequate fetal growth. Maternal stress and depression can have negative effects on various aspects of fetal development.
The fifth factor is maternal nutritional deficiencies.
Nutrition before and during pregnancy can have a negative impact on infant birth weight and development. Folic acid deficiency is associated with neural tube defects. Iodine deficiency is most preventable cause of brain damage from the second trimester of pregnancy through the third year of life, associated with intellectual disability, growth failure. How your baby's brain develops. Your baby's brain has been developing since they were in your womb. In the first trimester of pregnancy, nerve connections are built that enable your baby to move around in the womb. While in the second trimester, more nerve connections and brain tissue are formed. In the third trimester, the cerebral cortex starts to take over from the brain stem, preparing your baby for future learning. The human brain has three main parts. 1. Brainstem and cerebellum. These connect the brain to the spinal cord and control the body breathing, heart rate, blood pressure, balance, and reflex. 2. Limbic system. This sits on top of the brainstem and looks after many different functions including emotions, thirst, hunger, memory, learning, and the body daily rhythm. 3. Cerebral cortex. This consists of a left and right hemisphere and sits on top of the limbic system.
The cerebral cortex contains occipital lobe for vision, temporal lobe for hearing, language, and social interactions, frontal lobe for memory, self-regulation, planning, and problem-solving, parietal lobe for bodily sensations like pain, pressure, heat, and cold. How you can support your baby's brain.
Maintain a healthy diet. Talk to your baby bump. Exercise. Don't smoke or drink alcohol. Manage your stress. Avoid prolonged exposure to airborne toxins. Listen to music.